Good morning, everyone. Welcome to Reach Out and Read of Greater New York's annual literacy conference. My name is Emily Marchese, and I am the executive director of Reach Out and Read. I joined this organization a little over a year ago, which is about a decade in COVID years, as we like to joke around the office. It's been a year of challenges, of hardship, of loss, but it's also been a year of incredible resilience and hope. And that's because of each and every one of you attending this virtual conference. Reach Out and Read of Greater New York was able to reach the same number of kids this year, nearly 250,000 kids across 230 hospitals, clinics, and doctors' offices, with far fewer resources, because you, the pediatricians and site managers and community partners, would not allow anything else. Together, we would not cede that ground that our families depend upon us to protect. So while I miss last year's annual conference, all of us in the same awesome Clifford room, thanks to our friends at Scholastic, sharing bagels and Subway stories, today, now, we are still together. Together as Reach Out and Read of Greater New York, City's First Readers, the Reads Initiative, from the largest hospital to the smallest family clinic, we are still and always one united force for early literacy for little New Yorkers. Today, you'll be in the good hands of our extraordinary team, Kristen Rocha Aldrich, our program director, Carrie Kerjack, our program associate, and Michael Latito, our program fellow. We also have a few members of our wonderful board of directors joining us today. Welcome to each of you. And on behalf of myself, the board, and the team of Reach Out and Read of Greater New York, it is our privilege to support you, the pediatricians and healthcare workers who show up every day for our families, for our caregivers, for our children. With masks and gloves and a book in hand, you kept going. And I want to thank each of you for the gift of bearing witness to your heroism. If we were in person, I would ask you to stand and be acknowledged by all of us. So today, virtually, I want to extend this moment of gratitude for your sacrifice and your commitment to the children of New York. This conference is for your benefit. We want you to have the opportunity to come together, learn from one another, share best practices, and collaborate. So I encourage everyone to participate in the Q&A, in the networking sessions, and provide us feedback on what topics would be helpful in the future. Some basic housekeeping: please use the Q&A and the chat features throughout the morning. If you have a question, drop it in the Q&A, and if you have a thought to share, type it in the chat. If you're sharing something in the chat, make sure you click the drop-down arrow in the chat and select panelists and attendees. We are so proud of the 250,000 children we serve this year, and we will not stop. We will not rest until every child in New York City has the Reach Out and Read program, and we will not get there without the extraordinary gift of your partnership. So thank you for being with us today. And speaking of extraordinary gifts, I now have the privilege of introducing our keynote speaker, Dr. Sally Goza. Dr. Goza is the immediate past president of the American Academy of Pediatrics after serving her team as the 2020 AAP president. She is a general pediatrician and has had the privilege of taking care of children in her hometown of Fayetteville, Georgia for over 30 years. When Dr. Goza confirmed that she would be our keynote, the cheers of joy were audible across our virtual team. And for that alone, I'm very grateful to her for joining us today. Dr. Goza.
Thank you for having me. I'm going to try to share my screen, and I'm probably going to turn my video off because we're having internet issues in my office. I don't know what's going on, but we've been having them all week. So I'm going to turn my video off and share my screen. All right. So good morning, everybody. And I will just have to say ditto to everything Emily said about how wonderful it is with all you did through this pandemic. It's been an amazing year. Virtual meetings have become the sign of our times, and I look forward to the day when we can all meet in person again. 2020 was a year none of us expected or could have predicted. As we move into 2021, Now is the time to look at how the pandemic has changed our lives and how we practice pediatrics and what that means for moving forward into the future. A year ago, I could not have imagined what my year as AAP president was going to be. It's been a year of many challenges, but I also see opportunities to learn and make things better for the future of our children. In March of last year, as some of you guys know, our offices suddenly became ghost towns as parents canceled appointments and did not call to make appointments. They were doing what they were told to do, stay home and avoid being exposed to COVID. Parents thought doctors were all overwhelmed with taking care of COVID patients, and they were afraid to go to the doctor for fear of being exposed and wanting to keep their children safe. Pediatricians across the country reported patient volume dropping down to up to 80% in some practices. What we thought would be a short-lived dip dragged on into the summer, and as other specialties started to recover, pediatrics lagged behind. This was a significant financial problem for many practices, and we still have no data on how many practices actually closed permanently during this time. Even today, we hear that practice volumes are still down by 20 to 25% in some places. The American Academy of Pediatrics places studied showed that primary care and subspecialist pediatricians were worried about the financial impact on their work settings, the drop in visits, including the increase in canceled appointments and especially well child visits, staff layoffs due to the drop in volume, and the lack of personal protective equipment. These trends continue to affect pediatric practices across the country. To counter the drastic drop in patient visits, pediatricians were amazing at innovating and adapting their practices to the realities of the pandemic. Pediatricians separated sick and well visits either by doing sick visits in the morning and well visits in the afternoon, or using different office spaces, or even in some cases, if they had two offices, using two offices, using telehealth, decreasing and eliminating time in waiting rooms, using PPE, wearing masks, requiring patients and parents to wear masks became the norm in our offices. The American Academy of Pediatrics launched the hashtag Call Your Pediatrician campaign, and I can tell you, I think I referenced it in most of my interviews over my year as AAP president. The Places study also showed that the majority of pediatricians have been greatly impacted by these changes. So what does the future hold for pediatric practices? The AAP has been thinking about this and come up with some projections about what will happen in the future. And we're using those projections to envision and shape the practice of pediatrics moving forward. I believe we have a once in a lifetime opportunity to create the way forward for pediatrics, and we need to seize the day to build a future where all children can thrive. This slide shows the trends we're going to see that we think are going to influence pediatric care in the future. They include some that I'm not going to talk about: value-based payment models, computerized medicine, including artificial intelligence, family-focused healthcare, and community partnerships. But I am going to talk a little bit about the flexible models of care delivery, enhanced equity and social determinants of care, and also the emphasis on infection and prevention control and prevention, because I think these are going to affect how Reach Out and Read works. We're going to have more consumer-driven, more flexible models of care, meaning patients and families will have more options for where, when, and how they access care. And in the environment where there are going to be some obstacles to their getting care. Some of the high deductible plans may expand, narrow provider networks. So those are all things we're going to have to think about. The pandemic has created a dichotomy between essential versus non-essential services. How many times did you have parents wait till later on in an illness to bring their child in during the pandemic because they just didn't want to come in? I had a patient mother had him wait overnight with a broken arm because they didn't want to go to the emergency room. They called us the next morning to get them into a list. Anything considered non-urgent was being delayed or cut back, from surgeries to vaccinations, routine checkups to mental health support. And unfortunately, this focus on a single health threat has had negative and sometimes heartbreaking side effects. And while throughout the pandemic, the Academy has taken the stance that what is deemed essential versus not essential is not a dichotomy, but a continuum that takes into account the bigger picture and cumulative risk, We believe patients will continue to use the essential versus non-essential framework to evaluate their need for care. There's also going to be greater competition from non-medical home providers, and practices are going to need to adapt as well, what we call building a better mousetrap and partnering with urgent care centers, school-based clinics, retail-based clinics, and community-based programs to provide the services patients will perceive as having higher value. And according to that same survey, our members' use of telehealth has increased dramatically. Prior to COVID-19, only about 15% of primary care pediatricians said they used telehealth. And just 1 month into the pandemic, 77% of primary care pediatricians use telehealth. And we believe, even though we haven't done subsequent research, that those numbers have even grown more since, because that survey was done back in last April. A report by the Department of Health and Human Services also shows dramatic increases in telehealth use among specialists, with countless patients receiving important care while avoiding unnecessary exposure to the virus. And now that providers and patients have had a taste, it's hard to imagine the telehealth genie going back into the bottle for patients or physicians. And these trends that I've just talked about are likely to persist post-pandemic and will have impacts on the viability of some pediatric practices. And I think this will have implications for Reach Out and Read, as practices may struggle to financially maintain their programs. It will be critical to have more fundraising help and sponsorship for practices that are in need, and especially for those practices in under-resourced areas. And also, if children continue to miss well visits in the medical home, we're going to have to partner with other healthcare entities to establish that literacy-rich environment that's so critical to this program. But we need to do it where patients are being seen. There'll also be a renewed emphasis on infection prevention and control. Now more than ever, practices will need to show that they can keep patients and families safe when they receive care. The new protocols for delivery of pediatric care will likely remain post-pandemic, including that use of PPE, wearing those masks right now, temperature checks, screening before they come in, scheduling an office designed to separate sick and well spaces, and decrease time spent in the waiting rooms, or even in some cases, probably elimination of waiting rooms altogether. Practices may find themselves marketing safety as much as health. This trend will impact how we create that literacy-rich environment that Reach Out and Read is known for. If patients are no longer in waiting rooms for extended time, we'll have to figure out how to create other spaces. In our office, back last March, we took out all the books and magazines out of exam rooms and the waiting room due to the risk of spreading germs. And reimagining how to create that literacy-rich environment while maintaining good infection prevention will be a challenge, but I'm confident that pediatricians, and especially pediatricians involved with Reach Out and Read, are up to that challenge. We'd also like to see an expanded understanding throughout our law and policymaking bodies of what creates health, and universal acknowledgement that social and economic factors account for a full 40% of a person's health potential. Of course, this means addressing a social determinant of racism, which drives so many health inequities in our culture, because it impacts a child's body and brain, undermines the safe, supportive environments all children need to thrive, and has devastating effects on development and outcomes. The AAP ideal is that all children and all systems of care maintain health equity. And we have ambitious goals to make this happen by equipping pediatricians to create equitable systems, and by continuing to confront racism through child health policy and programs, as well as community engagement and broader social change to achieve equity within the walls of our exam rooms, throughout the health delivery and justice systems, as well as the halls of Congress. The Reach Out and Read program is a critical tool in this work. As the pandemic has laid bare the inequities in our nation, we need to work to expand the Reach Out and Read program to our under-resourced communities even more. I was able to give some books recently to a family where the parents were undocumented and have lost their jobs and are ineligible for unemployment. And as I only one child was actually eligible for the Reach Out and Read books, but we have some other books, and I decided to give the other two children, older children, books as well. And the older little girl's face lit up and she grabbed the book and she said, "This is the best book ever." And I know that they're struggling to be able to have access to books and reading, as the libraries are not as open and accessible as they used to be. If we are to reduce the damaging impacts of racism on public health, we must build inclusive literary programs that reflect the diversity of children in our communities. Our racism policy actually states, We must infuse cultural diversity and AAP recommended early literacy promotion programs to ensure that there is a representation of authors, images, and stories that reflect the cultural diversity of children served in pediatric practice. I'm really excited about the talks later this morning on this topic. Both students attending and not attending in-person school, preschool, or daycare may face emotional or behavioral challenges due to disruptions to routines. There's been widespread reports of the challenges that the disruptions and stress due to the pandemic pose to children's mental health or behavior. Even the early research reported high rates of clinginess, distraction, irritability, and fear among children, with younger children being more likely to exhibit these behaviors. Our children's emotional and behavioral toll from this pandemic will be something we deal with for years to come. As Dr. Andrew Garner said at the 2019 Reach Out and Read Forum, what happens in childhood does not stay in childhood. We need to invest now in behavioral health for these young children who have been isolated from the usual support systems of extended family, friends, and teachers. Reach Out and Read is more critical now than ever before as we struggle with overcoming the effects of the pandemic on our children. Supporting and expanding the reach of this early literacy program makes sense. Over the course of the pandemic, the biggest stressor for parents surveyed by the University of Oregon's Rapid EC project has been an inability to sufficiently feed, clothe, and house their children, not the fear of getting sick. Over 60% of caregivers who are experiencing extreme financial problems reported emotional distress, compared with just over 30% of caregivers who have no financial issues. The Rapid EC study found that high levels of emotional support, particularly from local sources, can help mitigate stress levels for families up and down the socioeconomic ladder, and that parents are finding a great deal of solace in their partners, parents, and even their own children. At first, the researchers thought when parents said they got emotional support from their children, they meant older children. But when they dug into the data, they found that people were finding their little ones to be a source of comfort, such as a midday snuggle with a book. Who doesn't love to snuggle and read to children? It just makes you feel better. Clinicians who implemented Reach Out and Read report positive impact on patients, families, and their own satisfaction and methods and practice. Clinicians value that the program addresses social determinants of health and facilitates developmental surveillance. Snuggling with the child makes the parent's heart rate go down, and I think it makes a pediatrician's heart rate go down too when you read that book with that child in the room. Even though we may have to re-envision how to implement the literacy-rich environment, it will be worth the effort. Our children have suffered from the pandemic in ways we are just beginning to quantify and understand. I know that Reach Out and Read has and will continue to be an important tool in enabling children and families to succeed, to decrease the inequities we see in our communities, and to make a difference for all of our children going forward into the future. And that is the end of my presentation, and I know we're going to have some questions later, so I'm going to stop my share. And thank y'all for having me for this conversation.
Thank you. Oh, there we go. Thank you so much, Dr. Goza. That is incredible and really gives us some good leeway into the next keynote that we are going to hear from someone local to New York City. So I am thrilled to introduce Dr. Goldie Alfasi-Siffert. She is the Regional Director of Behavioral Science in Residency at Mount Sinai and Mount Sinai-Beth Israel Residencies, and the Director of Behavioral Science in the Department of Family Medicine at Beth Israel Medical Center and the Institute for Urban Family Health. I'm also happy to share that she's an active member of the Reach Out and Read of Greater New York Board of Trustees. We couldn't be more proud to have her serve in our organization and speak to us all today. So without further ado, Goldie.
Thank you so much for that kind introduction. And let me just say that of all the hats I wear, the hat as coordinator for Reach Out and Read is one of the hats I enjoy the most. So thank you. And thank you to Dr. Goza for that wonderful introduction, wonderful talk. It was a really great overview of what's been happening during the COVID days. And I'm going to be talking today I'm going to zoom in a little bit more and talk today about the impact of COVID on the site where I work, and the ways in which it's affected Reach Out and Read, and the ways in which Reach Out and Read has adapted. So I am going to share my screen. Here we go. Okay. Okay, can everybody see this? Yeah, great. So here we are. The title is Surviving and Thriving Through the COVID Pandemic. And the first thing I want to talk about is the other heroes, the heroes who may not have been on the front lines of caring for sick people, but who supported those who did. Emily, our executive director, I just want to say, Emily came on about 3 minutes before the COVID pandemic hit, or at least it seemed to be about 3 minutes. And she hit the ground running, needless to say. It was her optimism and her energy and her excitement about what we were doing that I think kept us all going. The rest of the team, Kristen, Evelyn, Michael, Carrie, all of them extraordinary. They really guided us into the electronic age and really helped us. And Jack Pace, our amazing board chair, who has guided us with wisdom and patience through a number of years and has provided us with a wonderful place for the board to meet and a free breakfast. So thank you, all of you, for what you've done. We really do appreciate it. I'm going to talk a little bit about the place where I work to give you a kind of context for the impact that COVID has had on Reach Out and Read for us. So my site is a little different from the sites that Dr. Goza was describing. My site is a family medicine site. And there may be some of you in the audience who don't know what family medicine does. I didn't when I started working in family medicine, but we take care of patients cradle to grave. So what that means is we deliver babies. We then take care of the babies and the children. We watch them grow into adolescence. And when they become adults, we hang on to them. We keep seeing them. We have the opportunity to continue to work with them. And if we're really, really lucky, we get to deliver their babies and really take care of multi-generations. We also take care of their parents and their grandparents. So it's a very wide range of patients that we see. Now, that said, I just should say that many of our residents have gone into family medicine because they love taking care of adults, but they also really, really wanted to take care of kids. So the pediatric piece of our practice is extremely valued in our program and in all the family medicine programs. So we provide what is called routine care for patients, but I believe that the care we provide is very far from routine. The organizations that I'm affiliated with, the Institute for Family Health, really has as its mission serving underserved, under-resourced inner city families and providing them with high quality medical care. We run 2 residency programs at Mount Sinai Hospital, and those are the residency programs I'm going to be talking about. I'm responsible for their psychosocial education, the education of the residents. Our residency program is 3 years long, and we have 39 residents at any given time in the program. So just as the patients we see is a little bit different from pediatrics, our training is also a little different. So our residents work in an outpatient family medicine clinic for part of their training, but they also rotate through the hospital. And they rotate on a service of our own, a family medicine service, but also through many other services, including pediatrics, both inpatient and outpatient pediatrics, but also through OB and the ICU and many other departments. So if there are any questions about how we operate, you can either put them in the chat or we'll have an opportunity to talk about them later. But now I want to talk a little bit about how COVID affected our program. I'm going to talk first about the dark days of COVID back in March, April, May, June. Our residents were, it soon became very apparent that the hospital was going to be pretty overwhelmed by COVID cases. And so many doctors, including our residents, were pulled out of their usual rotations, their usual educational opportunities, and were, to use the hospital expression, redeployed. And that's actually not a bad term, because it really did feel like they were going into battle. They were pulled into work in the hospital and to see both COVID patients and the very sick hospitalized patients who did not have COVID. Remember, the only people who were getting hospitalized during those dark times really were people who were very sick and could not be managed on the outpatient basis. Those, you'll remember, those were really dark days. They still continue to some extent. People were getting very sick very fast, and doctors were working round the clock, watching people die, and feeling that there was very little they could do. We were at a complete trial and error stage of treating COVID at that point. And also feeling personally at risk. We were still working out how the virus was transmitted and what would be required to keep people safe. So very dark days. And this was happening at the same time, if you recall, as a real movement in our country, and Black Lives Matter really took on a new importance. Our program had always been focused on racial and class disparities in healthcare delivery, but this brought all this to the fore. And of course, the very differential rates of COVID deaths and COVID morbidity really hit home to everyone exactly what these health disparities meant in real life. The Black Lives Matter movement took to the streets, and many of our residents and faculty spent their little free time on the streets and protesting. Dr. Goza has talked about the financial crisis, which impacted us very much. Anybody working with poor folks is always kind of on the financial edge. And that was, we were no exception. And we had some very dark days financially, where people were expected to work significantly harder to try and bring in more money. I won't say too much about it now, because Dr. Goza has talked about it very eloquently. Now, since those darkest days, a lot has changed. There's been a very gradual shift to the new normal. Many of our residents have returned to a modified version of their training, and some patients have started to come back for in-house visits. The whole outpatient thing, Dr. Goza has described very well, that parents were very reluctant to bring their kids into medical settings. That is very slowly shifting, but the other piece is that parents have discovered that doing this remotely via telehealth has some advantages. So it'll be interesting to see where we go in the future. Our PEDS visits are still very much down, but the kind of plus side is that our residents are so enjoying those visits when they have them, and so appreciating being able to give those books. They come back into precepting, their faces aglow, and they invariably start describing the child that they just saw by saying, "This is a really cute kid." So here are some of the challenges, I think, that were faced by our providers in trying to do reach out and read during COVID. So the first thing was that we've talked about the very marked decrease in well child visits and the inability to actually give the physical book. But what about the parent education that we do so much of? Well, even when families came in, there was pressure to get patients in and out of the door quickly. And our providers, as you can imagine, were often exhausted and sometimes running on empty, and basically triaging, trying to decide what's the most important thing to do in this visit. And sometimes, it must be admitted, reach out and read fell by the wayside. There was an absence of important personnel, either because some people were working remotely or because, sadly, illness or even death. of important people. There was initially, and to some extent continues, some anxiety about COVID and its transmission via surfaces, and real questions about giving books and was that okay? And in the midst of all this, on July 1st, a new class of residents arrived in the midst of the pandemic who were not familiar with Reach Out and Read, and we had very limited training opportunities during that time. So the question for the Reach Out and Read team and for all of us was how to make Reach Out and Read relevant and helpful during these times. So here's a photo of how we adapted to seeing babies in real life. You'll see that the providers are masked, gowned, and goggled, as are the moms. But what you'll also see on these photos is the baby and the book. So here's a timeline. We're going to be talking about each of these in more detail in a moment. But what I really want you to see is that Reach Out and Read of Greater New York started adapting to this crisis in March of 2020 and put 4 programs in place. I want to point this out because in March of 2020, many of us, including myself, were in deep denial about the acuity of this crisis and the duration. We had really no idea how bad it was going to get and how long it was going to take. But the Reach Out and Read team really kind of went into action immediately, honestly, long before I was ready to think about this. And they put into place 4 programs, which I'll talk about in a moment. They developed new and old partnerships. They brought back town halls, and they've been involved with the New York City Health and Hospitals Test and Trace. So this was one of my favorite things that they did. It was the weekday read alouds. So very quickly, they moved to virtual programming. And they started in March, and this program is still running, the weekday read alouds. And you know what I want to say is that this kind of shift to virtual programming taught us a lot about learning to adapt to changing conditions and to evolve under really challenging conditions. So the virtual programming, this started in March. It was every day in the beginning, and we had volunteers, authors, doctors, board members reading stories aloud to children. And here you see Jamila Tompkins Bigelow reading her book, Mommy's Kimar, a wonderful book. I don't know if there's going to be time, but maybe at the end of the talk, we can listen into a little bit of it. We'll see. And just to tell you, this is continued successful. It's now down to 1 to 3 times a week, Monday, Wednesdays, and Fridays. But over the last 3 months, over 7,000 people have tuned in. And here's a picture of Jamila. The other very successful initiative was the bilingual parent caregiver workshops. We call those Reach Out and Connect. And there were 35 workshops so far in both Spanish and English. And what they were was a real expert in the field talking about useful tips for supporting development of young kids at home. And just examples, using children's books to discuss race and racism, preparing for a new baby during COVID with Dr. Gina Reynoso, who is here today, behavior management, creating a literacy-friendly household. And this was really important because a lot of in-house services for parents and support services were either suspended or changed in important ways. So this did provide support and encouragement for parents. It's still running, it's still reaching hundreds of families across Greater New York, and you can access this via Facebook, YouTube, or through our own website. And I'll have a resource page at the end of the talk. Now, not everything we tried worked, and it's important to talk about how we experimented, trial and error, and to tell you about the things that didn't work. So we tried a phone service, and this was a phone service where parents, families could make an appointment with an expert, a 10-minute appointment to ask a question and to get some tips. And this was just completely underutilized, and so we discontinued it. The other really, what I thought was a really cute idea, was having an activity calendar. And this did in fact run from April through June. These were activities you can see in this calendar where ideas for families and kids for things they could do together that were kind of educational and fun and that would keep kids busy during these difficult times, but also underutilized. And so from April to June, we ran it and then it was discontinued. We really created and fortified existing literary partnerships with all of these organizations that you see here. And this was very important. This was partially done through our webinars, and we invited people who were associated with these organizations to speak. And they did a fabulous job. So we became much more familiar with the missions of our partner organizations and the people who worked there. For instance, in June, we invited Shanti Burns-Simpson, who is the president of the Black Caucus of American Library Association, and she's here today, welcome, and who did a wonderful talk about using books to start conversations with children about race and racism. Many of these groups were featured during these talks, and they shared a wealth of knowledge and their different perspectives. And we were so happy to be able to share these with our families. We reinstituted town halls. We started them again in August. And these are opportunities for people like me, Reach Out and Read coordinators, and medical providers to connect and to problem solve around issues, both around Reach Out and Read and other issues. They've been held quarterly. Just as an example of some of the topics, you see here some of the folks on one of the town halls. Some of the topics were the effects of COVID on the sites, all the issues that were coming up around telehealth and building relationships both with families and with Reach Out and Read providers. Now, this, I think, is one of truly the most creative ideas that our team came up with. So, as you know, many of the families we serve use Health and Hospitals Corporation as one of their primary sources of medical care. And the Health and Hospital system set up in New York City a test and trace core. So they provided rapid COVID testing for folks in New York City, and they set up 17 of these testing locations around the city. So these testing locations were seeing an average of 200 people a day. So if you do the math, about 3,400 people per day coming through these testing locations. So we started by training over 50 of their resource navigators. You see some of them here. And we donated 30,000 books for them to distribute as part of their testing protocol. Now, the next thing we did was the Take Care kits. So if you tested positive, you were given a Take Care kit. You were urged not to go to the hospital, not necessarily to go to your doctor to see how you felt, but you were given lots of information about what to do should your symptoms get worse. But people complained about these Take Care kits. They said they were kind of cold and kind of medically oriented and really didn't take into account how people were feeling about all this. And so we partnered with City's First Readers, and City's First Readers helped us to donate to these Take Care kits, books, crayons, stickers, and activity books that we could hand out to children who were whose families were testing positive. And we plan to contribute 5,000 of these Take Care kits in the next month, which I think it's just such a very wonderful pivoting and using what's out there to get our message out. In addition, the other thing we've done is, the city set up quarantine hotels where families who had no other options were able to go and quarantine if they tested positive. And we donated a cache of used books to those quarantine hotels so that the kids would have something to do and something to read while they were in quarantine. So just a few things about lessons learned that I'd like to say before I stop. First of all, the first lesson, and one that's going to be, I think, emphasized throughout our talks and workshops today, was healthcare disparities and racial injustice. We really saw in an undeniable way the way in which healthcare disparities played out during a crisis, and the way in which the communities that we serve were disproportionately affected by COVID. And began to really shift in thinking about how to think about what can we do to, in some ways, have an impact on the racial inequalities and class inequalities in our society. We also really realized the necessity for systems, regardless of what systems they are, whether it's a healthcare system or a reach out and read system, to be nimble, adaptable, and responsive to changing situations, because one thing COVID has taught us, change is inevitable. And finally, and lastly, but perhaps most importantly, Bill Clinton had a big sign in his office when he was president that said, "It's all about the economy, stupid." I feel like I want to have a big sign that says, "It's all about the relationships." And indeed, that is one of the many lessons of COVID that we've learned. It is about all our relationships and their ability to sustain us through difficult times. So I want to thank all of you for all that you do. I want to thank the Reach Out and Read team for their extraordinary efforts. And thank you all for your attention.
All right, thank you so much, Dr. Alfasi-Siffert and Dr. Goza, for those wonderful presentations. I know I learned a lot, and I can imagine our participants did as well. So I figured now would be a great time to open it up for a Q&A, just to exchange some ideas between Dr. Alfasi-Siffert and Dr. Goza. So participants and attendees, please feel free to type your questions in the chat. And for now, I figure I can just get the ball rolling on a couple of questions, if that's all right with both Dr. Alfasi-Siffert and Dr. Goza. So, all right, let's do it. So the first question I have is, Dr. Goza made a really interesting point about how she believes that pediatric waiting rooms will likely not return to their status as busy, crowded hubs of literacy in the future, at least not for a very long time, right? So because of sanitation concerns. So considering that a literacy-rich waiting room has been such a staple of the ROR program over the years, what are both of your suggestions for other ways in which we can cultivate literacy-rich environments in clinics?
So I'll start because I just learned something about the YouTube videos of having people read books and put on YouTube. And most offices have guest Wi-Fi. And so you could have the parents go to the YouTube site and actually, while they're waiting in the exam rooms, have their children a child in a thing like that. So I'm going to use that in my office, actually, starting tomorrow. So I think really being innovative of how you model that reading to the children, either having them do it on their phone, having iPads in the office that they can look at it on. Even in your office, if you have a TV, you could put a video up for the short time they might be in the waiting room, checking in or something. So I think all of those things. And I hope there will be a day when we can put books back into the exam rooms without it being an issue for infection prevention and control. I do think that time will come, but it's probably a little bit down the road.
Yeah, I completely agree. I don't have too much to add, except to say that infection control, as you know, has always been something of an issue in waiting rooms. We've tried putting out toys in waiting rooms for kids to play, and then we got slammed, and it's always kind of a little bit of a difficulty. And of course, for us, it's even more complicated for a number of reasons. One is that we have very limited space. We're in Manhattan, so our waiting rooms are like this, and we have adults and kids together. So you can imagine that we're going to really have to be rethinking our whole waiting room. What we've been doing during COVID is really keeping very, very few people in the waiting room. And as a result, we've really lowered our census of people who we allow to come in. I think this is going to put a lot more emphasis on what happens in the examining room between the doctor and the patient. I think it's just going to have to shift. But I agree that the electronic stuff is going to be increasingly important.
I love that point, Dr. Alfasi-Siffert, about the exam room kind of rising in prominence in the way that we try to make that literacy rich. And I know Dr. Goza has made that point elsewhere as well. So very interesting food for thought there. So then my next question that I have here is, a number of our providers have expressed to me in my site visits with them, virtual site visits, that they are experiencing some difficulty because of the pandemic in allowing them to do little things like high five or hug their patients. And so have either of you found this to be a difficulty in your own practices? And if so, what strategies can providers employ to help build those bonds with patients while still respecting social distancing guidelines?
Well, if you like, I can start on this one. I actually had a conversation with some of my residents yesterday about Reach Out and Read. And, Reach Out and Read is like the ideal substitute. Ideal. It's like it was meant to be for the high fives and the hugs, I think, because it allows the doctors, even masked and gloved and, with all their protective gear on, to really engage with the babies. And seriously, you should watch the residents. I really believe that Reach Out and Read acts as a kind of a little bit of an antidote to burnout for them, because they're actually able to do what they love, which is engage with patients. So I think we can really push this as a burnout antidote and as a way of engaging. And I think that is really helpful.
I agree with you on that. I think it's been amazing to me how patients will still smile at you when you've got your mask and your goggles and all that on. But if you talk to them and your eyes show it, they just start to giggle. These little babies will just start to giggle and laugh. They love to look at the books with you. I do elbows. I've learned to do the elbows. I had one child who almost elbowed me with a really sharp elbow the other day, and I was like, ow. So, I think that this is great for Reach Out and Read. I mean, I think every office should start doing this, because it is that way to engage with the patient, and it engages with the parents too, because, and it's not just the child you're seeing, every other child in the room wants to come see the book too. And so it's actually a great way to engage the whole family.
That's wonderful. Thank you for sharing that. And I see we have some activity in our chat on this point. Dr. Sapoulas, I think I'm pronouncing that correctly. Forgive me if I'm not. But doctor is saying that the patients love when she attempts fancy toe taps with them as well. So maybe a little bit of social distance dancing and whatnot, of building that around giving the book out. So that's really awesome. Thanks for sharing your thoughts there. And then sort of the last question I have here is that one controversial topic in the literacy world right now is the role that ebooks might play in the future. So especially considering how the pandemic has restricted access to libraries and bookstores, what are both of your thoughts on the role that ebooks might play in building literacy going forward for your patients? Do you feel that they'll be super beneficial, extremely detrimental, somewhere in between? How do you advise parents on this issue?
I'll start. I'm not a big fan of ebooks for myself. I like having a book and turning the page and all of that stuff. I think that, we all have to change with the times, so and adapt. And a lot of the younger generation loves ebooks. They like not having to have the paper and have to store the other books. I do feel like children need that book to touch and to feel and to be able to look at all of that. And so I think it's going to be a balancing act of making sure that some children still have the books that they can turn the page, sit with their parents and look at, versus just looking at a screen. Because we do try to tell parents they should not have their children on the screens that much, and an ebook is a screen. And so it is still reading to them, luckily, but it's still a screen. And so I think it's probably right there in the middle.
Yeah, and I think there's also a developmental piece to this, which is, if you're talking about a 5-year-old, they're really used to screens, and it's possible for a 5-year-old to sit there with a screen and scroll through on their own. With a baby, it's a whole other story, I think. And you really want the baby to certainly have the tactile experience. And so many books are like Pat the Bunny type books for little kids that are not just visual, but also the whole experience. And as we know, babies are likely to put books in their mouth to kind of really discover the nature of a book. So I don't think that part's going to change anytime soon, frankly. The other piece is the piece that Dr. Goza mentioned, and that is the parent-child interaction piece around books. And basically, my advice to parents would be, only do this if you feel like it's comfortable for you and it allows you and your child to have a time where you're sharing this. If it becomes you're in one room on your telephone and your kid is in another room looking at a screen, that's not the point of this. The point of this really is, in the early years, for this to be a time where parents and children can share the joy of reading together. And if you can do that on a screen, okay. But if you can't, then let's go back to the old-fashioned way. I do not know if we're fighting a losing battle here for the older kids. We may be, but I think it's a battle worth fighting.
I love the nuanced answers that both of you presented there, sort of showing the pros and cons of both, and gave me a lot of things to reflect on going forward, and hopefully the same for our attendees. So. And Dr. Alfasi-Siffert, I know some of our attendees in the chat are agreeing with your point about the books being helpful in engaging fine motor skills. So hopefully they've been able to connect with some of these points in this discussion. And that's all the questions I have for both of you today. And so if anybody else has a question, let's see. Okay, so I have one from Emlyn Martinez, who is our wonderful site coordinator at one of our sites. And Emlyn is asking, how will this time with the pandemic impact the practice, or maybe the ebooks? I think maybe Emlyn is wondering about the ebooks. How will that impact the practice of serve and return that we try to cultivate with the children in reading?
Oof.
It's a good question, I think.
Alfasi said that perfectly, is that if people are comfortable that they can do that volley and serve with an electronic book, then more power to them. I don't sure how you do that, because I think so much of the book is turning the pages, looking at the pictures, pointing to something and saying, what's this, what's that, all of that, which you could probably, people that are more screen savvy than I am might be able to do that. But I think it's that interaction and that volley and serve that's so important. And so I think it could affect it if you're not careful, and that would be my concern with the ebooks.
Yeah, I agree. And the turning the pages, the ability of the child to have increasing control over what the input from the book, and the parent's ability to gradually allow the child to have that control. It's a little more complicated, I think, in some ways, electronically. I guess you could have the kid swiping, but it's a little hard for a little kid to do. I guess they learn how to do it. I'm really struck by how my own experience, both as a kid and as a parent, really shapes my answers to this question, because I had books and I love them so much. So I think I'm kind of reverting to that. It may be that a whole generation of parents and children can work this stuff out and make it happen with electronic books. But you're talking to probably someone of the wrong generation for that.
I love the introspection there, Dr. Alfasi-Siffert. And I agree, we might be at some sort of a tipping point here where we can, just reflect on what we did in the past, and then maybe we got to change some elements in the future. But I think the important thing is that we're thinking about it, right? So I think this has been a wonderful Q&A, and I think we might have had one person who was interested in asking a question that we haven't received yet. So we can,
I'm going to unmute them,
Muhammad.
actually.
Okay, great. Yeah.
So they can ask their question live. Give me 1 second.
I think it's Dr. Muhammad, if I'm correct. We're working out
to ask the question. You just have to unmute yourself.
Hi, everyone. Hi, Michael. I want to make a statement. I do agree with Dr. Goldie and Dr. Sally about turning the pages and so forth with the books while moms are reading with their children. But we are at a different stage. You know, you said COVID is bound to bring some changes, and this may be the time where e-reading is going to be introduced more and more, and to reach out and read. And we should really take a look at that, because the young parents, that's what they're doing. And I love books, but we also have to start thinking the new generation. So
Yeah.
a seed planted.
Agreed. It's a wonderful perspective. So glad that you volunteered that perspective, Dr. Muhammad, and thank you for joining us.
Thank you.
Great, great. And we have Francine here saying that she thinks ebooks will work well as almost every child has a computer, tablet, or phone and is savvy with that. So wonderful activity here in the chat on this topic. So this is great. I think we can wrap it up now because we're right at time. So I just want to thank both of you again for volunteering your time. We appreciate it so much. And again, learned a great deal from your presentations, and just thank you for all your commitment to the program and your patients and community. So thank you.
Thank you.
Thank you for having us.
Great. So we are actually slightly ahead of our time, which is not something I think any of us were expecting to say. So we do have an opportunity for a couple more questions if anybody has those. But if not, what we are going to do is switch things up a little. We are hoping to welcome Council Member Stephen Levin for a few remarks. But he is not here yet. So we are actually, we'll leave it open for questions for about 2 more minutes, and then we will break until 10:10, when we should be hearing from Council Member Levin.
So Kristen, I think we have a question from Francine in the chat about, are there any new trainings for primary care providers or anyone working with Reach Out and Read coming up? So I figured that might be one that you could answer.
Happy to, yes. So we are working on a training with, I actually piloted it at Staten Island University Hospital with the residents, and was there in person, which was really incredible back in October, on some of the pieces that were actually highlighted during both keynotes today about building relationships and taking your Reach Out and Read practice to the next level of, you know the brain development, but as Goldie said, it's really about those relationships. I want that sign too, Goldie. Carry it everywhere. So that is definitely coming down the pipeline. We're trying to figure out a way to do it virtually as well. And then
yeah, go ahead, Kristen.
Another question. In the discussion of serve and return with ebooks, does the ROR team have any plans to demonstrate this to parents and providers? That is definitely something that we can do. I love that idea. We can put together some mini training videos. Dr. John, fabulous idea. We will get on that.
I think there's 2 more, Kristen, from Gary Chin in the Q&A, and then one from Emlyn again, a couple more.
All right. So Gary Chin had said, you can't duplicate the tactile feel of turning pages of a book and the importance for a baby to acquire the dexterity of their fingers to navigate the pages. Yes, definitely 100%. And then another question from Emmeline. Has ROR considered partnering with IT groups such as Google to develop innovative interactive reading platforms for young families? That is not something we have done. However, Emmeline, I couldn't have asked you for a better plant to announce an upcoming partnership with Books, actually, who have developed a beautiful platform for ebooks that doesn't have any bells and whistles or advertisements or anything. And they are, I was going to save this for my closing remarks, but they're actually donating 75,000 free logins for 1 year for our families in Reach Out and Read of Greater New York. And so tomorrow at the town hall, their director of social impact will be there demonstrating it. And we'll also roll out a training for providers. And I think that would actually pair quite well with Dr. Jen's question of serve and return interactions with ebooks. All right, any other questions?
I'd just like to say that Books connection will be great with the telehealth visits as they go forward, because you can actually let the parents do that. The other thing would be the YouTube. If you have a patient waiting for you on a virtual visit, you could connect them to the YouTube where somebody's reading to the child too. So I think those are all really good ideas as we go forward with telehealth. How can you still have a literacy rich environment and doing telehealth visits?
Right.
That was what inspired the connection, was telehealth. We still wanted to figure out a way to get books and a telehealth visit.
Yeah.
Absolutely.
I think we still have some questions in the Q&A as well. We've got some new ones there, Kristen, if you want to.
Okay. So here's this question, and I had a feeling this might come up today. So what do you think about Dr. Seuss getting canceled? We all grew up with Dr. Seuss. I am going to say something right here that I think is important to address. If you look at everyone on this screen, every single one of us is white. So our experience in this isn't the experience that should be speaking. I think this is something that potentially can be discussed in the using children's books to discuss race and racism. But I will say, as a policy, Reach Out and Read of Greater New York, we do not buy Dr. Seuss books because of his racist practices. And yesterday there was even an article that came out that showed, I believe it's Random House or Penguin, or they might be the same now. They're stopping printing a selection of his books that depict racist characters. And I think that's a step in the right direction. And yes, Dr. Richards, Dr. Seuss didn't get canceled. It was only 6 books that got pulled. So I don't know if anybody else here would like to speak on that as well. All right. I think just double checking the chat and the Q&A to make sure everything was covered. I do see a comment from Allison about working with NYPL to connect her patients to resources, specifically Grab and Go. That's fabulous and a best practice. I think if everybody could do that, whether it's whatever your local library is. And then we do have one person asking if there are any. Okay. No other reactions on Dr. Seuss. We'll hold those. If anybody else here would like to react, please do. If not, we will save that.
I just have one thing I want to say, which is that I read some Dr. Seuss books to my kids, and I have to say, I don't remember the racism, and I thought, how did I miss it? How was it possible that I missed this? And I really feel like we've had to have an awakening to the ways in which things that we just let go in the past and didn't pay any attention to because we weren't affected by them directly. And it, you know, it's time to refocus and to rethink the things that we took for granted in the past and that were wrong.
Yes.
Agreed.
All right, so let's go ahead and Carrie, transition us to our video. We'll give Council Member Levin a few minutes to join, and then if not, we will keep chugging along, and we'll talk about Cities First Readers.
So this is a book for Christian.
Thank you very much.
This is for you.
See, look, it's a mouse book.
And you can read it, and you can read it with Christian. And we're so happy that you guys are here. We're so happy to see you. And this is something that you guys can do at home when you know how much your kids love books.
Absolutely. Thank you so much. We'll add it to our collection, right?
Yeah, and you can read it with Christian too. And show him pictures.
Thank you, Carrie. That gives you a little peek into what we are doing. So I am going to go ahead and deliver Councilmember Levin's remarks on his behalf. Let's see. Alrighty. So. Okay. So initially we had planned for Councilmember Levin to speak about Cities First Readers, a really important initiative that we are a part of, and I know that many people present today are a part of as well. So the speeches you've heard and the panelists you will hear from today highlight the importance of early literacy from birth. Something that Cities First Readers partners do on a daily basis. Many organizations are focused on learning loss for school-aged children. Oh, perfect. Oh my goodness, Councilmember Levin, I just started speaking a little bit on your behalf, so I'm going to stop.
Sorry, I have a vote that's happening at the same time, so I apologize. I'm doing double duty here.
No worries. You caught me one sentence in, so perfect timing.
Okay.
So I am thrilled to introduce our wonderful council member and who is an incredible advocate for Cities First Readers. So thank you so much for being here today. We really appreciate it.
Oh, it's my pleasure. Thank you, Kristen. Good morning, everybody. And I want to thank Reach Out and Read for convening this conference today and for having me speak a little bit about Cities First Readers. Cities First Readers is a really something I'm very proud of being a part of. And hold on one second, I apologize. I need to mute what's going on here. There we go. I apologize, sorry, bear with me here. Sorry, sorry, I've got double things going on. Is it sound muffled at all, or
we can hear you?
Okay, as if there's other things. Okay, so I've just been thrilled to be part of Cities First Readers, and I'll share a little bit about the background. I got elected in 2009 and started in 2010, coming out of the financial crisis, and so for the first few years, when I was in the council, the city's budget was in bad shape. We were cutting every year in the budget, and losing essential services every year, and it was very difficult. Starting in 2014, which was coincided with the de Blasio administration and a new speaker in the council, Melissa Mark-Viverito, we had the opportunity at that time to add new funding into the council's budget. The council's budget, represents a small portion of the city's budget overall. We have a certain amount of funding that we call, that the council has discretion over, and there was this opportunity that year to add new, what we call initiatives, into the council's budget. And so I had a relationship that we had developed over the prior 4 years with Reach Out and Read, as well as a number of other literacy organizations, including all the libraries, the library systems in New York City, Literacy Inc., Jumpstart, Parent-Child Home Network. So we had, and several others. And it was, there was a wonderful program out of Bellevue, the Video Interaction Project with Dr. Alan Mendelson. And he's worked obviously really closely with Reach Out and Read in the hospital system. And we started, so we developed this, this initiative in a way that was collaborative with all of these organizations. And it was very gratifying because the organizations came together and started developing an agenda and started figuring out who could do what and how different organizations complement the services of the others. And the focus was on early childhood literacy, so 0 to 5. And there's a tremendous amount of focus on school age literacy, as well there should be. But we did not see any kind of programming in the city that was sponsored by the city, that was, had an ongoing commitment from the city, really focused on that 0 to 5. And, as a parent now, I have a 4-year-old and a almost 2-year-old, and they are, the importance of engaging with them on reading is, at those ages is absolutely, fundamental. And if we're not reaching kids at those ages across the board, sorry, if you can hold on 1 second, I have to.
Politics in action, friends, and multitasking in action.
Okay, I voted, all good. Sorry. This was the focus really being on how we can leverage those partnerships. And what we saw really quickly, and we were able to also allocate some funding to have some qualitative and quantitative metrics and review so that we could go to other funding sources, back to the council, to the administration, and show the effectiveness of Cities First Readers as an initiative. And what I found so heartening, every year that we would go back to council members, we would see more support for Cities First Readers than almost any other council initiative. There's about 120 council initiatives, and going, and they've been added to the budget, going back 25 years. But every year consistently, Cities First Readers is in the top 5 or 6 most supported initiatives. And as a result, in the years that have been good budget years, there's been an increase in the budget allocation for Cities First Readers. I mean, almost every year. I think last year was the first year that there was a slight decrease. Maybe there was one year where it didn't have an increase at all. But it's a testament to the level of partnerships in communities that the organizations have been able to demonstrate. The clear need for this focus on cities supporting early childhood literacy programming, and the collaborative nature of the initiative and the groups and how they've worked together. There's quarterly meetings, but there's all types of interactions between these groups, and so I mean, just as this is a kind of a little bit getting into the weeds here, but a lot of most council initiatives, or a good number of them, are they're just there'll be like a certain program area, like say supplemental sanitation services. And the way that those work is that each council member gets a certain amount of extra funds to distribute as they see fit. So for the Cleanup NYC, which is that sanitation one, we each get $100,000 to distribute 4 sanitation services in our district. This is not like that. This isn't extra funding for council members to distribute. This isn't, they don't get to cut a check, have some kind of check that they can hold up to local groups in their district and show, that this is the council in action. This is targeted and really based on the recommendations of the groups themselves, and it's only grown over time. So not just in terms of the council funding for it, but in terms of the in terms of that level of partnership and that interconnectedness between the organizations and how they feed off of each other. And so we're approaching, I think it's year 6 or 7 now, and I think that those partnerships have only gotten stronger, which is really heartening. I mean, you can imagine there being competitiveness or things not working out well. The exact opposite has happened here. It's only gotten stronger. Now, and I want to give credit to Councilmember Antonio Reynoso, who's been, since his first year in the council, a co-sponsor of this initiative. And he's made sure that it's gotten the attention that it needs. And he is in 2 different delegations. He's in Brooklyn and Queens delegation. So he's made sure to make sure that support is there in the Queens delegation as well. Councilmember Vanessa Gibson has been very supportive in the Bronx delegation. Councilmember Debbie Rose has been supportive in the Staten Island delegation. Margaret Chin has been supportive and Ben Kalos has been supportive in the Manhattan delegation. And of course, Speaker Johnson's been very supportive as well. So anyway, I've just been so gratified to see the success of Cities First Readers, and Reach Out and Read is a linchpin to this initiative. There's been just positive results out of it. Now I'm leaving office at the end of this year, and so one of the things that I have to figure out is which council members, starting next year, there's going to be a whole new class of council members, who's going to really take on the focus for Cities First Readers and take responsibility and make sure that it stays in the budget and continues to grow. So that's one of my, one of the tasks that I have between now and the end of the year, is making sure that there's like a new sponsor for Cities First Readers. And I have some people in mind that I've been talking to already. So, but I just want to thank Reach Out and Read for the opportunity to be here today and talk a little bit about this initiative and just express my gratitude for ensuring that the initiative has been successful, because it's obviously there's nothing more important than giving our children the tools to succeed at every step in their lives. And again, as a parent of young children, I now see that more vividly than ever. And I really hope that every child in New York City has the same opportunities that my kids have.
Thank you so much for joining us today.